We're about to travel through a mouse's leg bone. This tiny canal normally carries blood into or out of the bone marrow. Researchers have known for a long time that bones have an efficient system of blood vessels to enable immune cells made here in the bone marrow to move quickly into general circulation. But they've only just managed to see the many microscopic vessels that play a key role in that process. As we zoom out, you can see lots of small holes marking the entrance and exit points of these teeny capillaries. Without knowing it, trauma surgeons have been making use of this fast and direct transport system for years. When they can't get quick access to a patient's veins, instead they inject drugs or fluid directly into the patient's leg bone. This technique, first developed by the military and used on battlefields, is called intra-osseous infusion. To figure out how intra-osseous infusions work, scientists turned to a technique called clearing. This involves washing away the fatty membranes that surround cells to make whole organs see-through. It's been applied to many structures, including hearts. Making bones see-through has proved trickier. But recently, a team in Germany managed it. This mouse bone, the size of a matchstick, is a tibia or leg bone. The team found that by using a chemical called ethyl cinnamate, a component of cinnamon, they could make the opaque bone become like glass, leaving the blood vessels intact and visible. Now, using a microscope, the researchers could examine the blood vessels. They could clearly see the large arteries and veins that are known to carry blood in and out of the bone marrow. But looking more closely, they also noticed hundreds of tiny blood vessels running straight through the bone from the bone marrow to the outside. The team named them trans-cortical vessels, or TCVs. What's more, by staining a kind of immune cell called a neutrophil, the team was able to watch immune cells, the yellow blobs, actually travelling through the TCVs. These long overlooked vessels seem to play a really important role in bone physiology. In fact, the team calculated that the majority of blood flowing in and out of bones actually passes through them. And these vessels are not unique to long leg bones. A few months ago, another team described similar microscopic channels that cross the skull and connect directly with the surface of the brain. This rather blurry video also shows immune cells moving through the channels. Understanding how immune cells move from the bone marrow to local sites of injury or disease could help us to treat stroke, as well as inflammatory bone conditions such as arthritis. So far, the experiments have been done in mouse models of these conditions. But the teams suspect that TCVs are common in human bones too. To look for them, one of the authors did an MRI scan of his own leg. This is a cross-section of his thigh. If we focus on the bone and then zoom in, you can see tiny holes that look like the openings to the tiny vessels seen in mice. Signs of a network of previously unrecognised blood channels that open up new routes for medical research.